So, ladies and gentlemen, welcome back to my channel once again. Yesterday, I showed you what you need to put a cannula in a patient, and today I'm going to show you how we insert a cannula. And as I said before, you're going to explain or introduce yourself to the patient. Then, after introducing yourself to the patient, and then you explain the procedure to the patient. Yeah, so I've already talked to the patient, I've already explained myself to the patient and all the procedure. First step, always disinfect your hands. Second step, Stauschlauch. This is just to tie around the hand of the patient. It's already ready. And then you have your peripheral cannula. Open. You leave it inside, like the way I told you before. And then you have your stop cell right by there. And then the next step, a tupfer. And we need 2 or even 3, but mostly 2. But before I do that, I'm going to put on my animal handshoe. Yeah, you put them on. All ready. And then don't forget you have your stop cell ready. You can open it so that it can be ready and easy to use it. And then now let's make or prepare our tupfer. So I take, let's take 2. Yeah. So 2 of them, one dry, one. So dry one, you can leave it like that. And then this one, you take your antiseptic and then you put it on the tupfer. This is how you prepare the tupfer. In some other places, it's already prepared, but in a place where it's not prepared, this is how you prepare it. You use antiseptic, not disinfectant, antiseptic material. So I'm going to teach you again about the different types of antiseptics and disinfectant materials. So we have our tupfer already. Yeah, and then don't forget, this is the sharp box. Yeah, always have it next to you. If it's not there in the patient's room, I've just brought it here for the purpose of learning. So after explaining everything to the patient, now you come and expose the parts. First of all, you have to pull it, blue thing here, you pull it like that so that you don't have a problem when you're fixing the cannula. And then you expose the hand of the patient only. Patient's privacy is very important. Now after exposing the hand of the patient, the next step, take your Stauschlauch. Yeah, as I said before, this is to put pressure in the hand of the patient, like that. Yeah, and then you tighten it like that. Tighten it. You can also put this green thing under the hand of the patient, under the arm of the patient, so that to prevent blood or blood from spilling on the line took or bed sheets. The next step is make sure you see the blood vessel that you want to insert the cannula. Which one is more feasible? You come here and see. For me, I see this one here. So I take my tupfer, and then the place that I want to insert the cannula is here. So I swipe once. Yeah. And then after swiping once, now you take your cannula. Yeah. open the flies like that, butterflies, and then take off the cap, and then you push it like that, and then you see backflow, and then you pull this. We have the needle, so you pull it. When you pull it, you see the backflow. You just push with this finger direct like that, and then now you take your dry tuphar, you put it under the arm of the patient like that. Yeah, and then now you remove this one, the needle, like that, in sharp box, and then you take your spulum, like that, and then now you can remove from there, and then flash the line. After flashing the line, now you take your stop cell and close it like that, and then with your dry like that. Yeah, dustbin. Right now I don't have it here. Yeah, and then the next thing is your plaster. So this is how it looks like here. So we start with this one. The first one is to cure the first butterfly. And then take the second one like that. You secure the second butterfly like that. And then now this one, you separate like that. This, throw it away, and then again separate again from here like that. It's a transparent plaster like that, and then you make sure this transparent part, you can be able to see where the needle inserts at the skin. So take it like that, and then you can now remove the top part like that again. Now you can see, we can be able to see where the needle inserts at the skin. It's visible. And that is, ladies and gentlemen, how you insert a venom bag like that. So thank you very much, and follow for more tips. I'm going to teach you again how we do blood, to withdraw blood from the patient. Blutabnehmen. Genau. So I'm going to show you how do we remove blood from the patient, and I'll also go teach you the kind of tubes that we use for various blood samples. So for today, thank you very much, and I wish you a happy day, a happy time, and feel Spaß.